Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Hi, I'm Caitlin Tivnan. Thank you for watching Health Watch, presented by UMass Memorial Healthcare. Today we have a look at a very important topic, talking about pancreatic cancer, and we're asking the doctors to explain exactly what it is.
Pancreas cancer is a cancer that involves the pancreas, which is an organ that lives in the upper abdomen, and it's primarily responsible for creating hormones such as insulin, which regulate your glucose, and for creating enzymes, which digest the fats that you eat, or the food that you eat. And right now, pancreas cancer is the fourth leading cause of cancer deaths in America.
Doctors say pancreatic cancer can be difficult to diagnose, and often patients don't recognize symptoms until later stages.
Most commonly, patients present with unexplained weight loss or vague abdominal pain, possibly in the upper abdomen radiating to the back. But really the problem is that symptoms are difficult to diagnose, and so we see people present only when the disease has progressed and symptoms such as jaundice or yellowing of the skin or eyes are evident.
Is it hereditary, or do we know a cause?
So we're starting to get a better understanding of causes of pancreatic cancer. We do believe that smoking and diabetes and pancreatitis contribute to the development of pancreas cancer. And there are certain genes and genetic syndromes that are associated. For instance, if you have a family history of pancreas cancer in a first-degree relative, specifically someone less than the age of 50, you should make your physician aware of this, as it might be associated with pancreas cancer in future generations.
So if someone does have pancreas cancer, what would a typical treatment regimen look like?
So treatment varies by patient and presentation, but generally could involve surgery, which is removal of the tumor by a surgeon, chemotherapy, and possible radiation therapy.
How long does it last, typically? Long process, or?
It varies again by presentation, but in general, surgery involves a hospital stay of about a week based on the resection or the surgery that you have, and then chemotherapy generally involves a few months of treatment. But again, it's very variable based on patient presentation and tumor type.
Now, you mentioned something about intertreatment and a different interdisciplinary approach. Can you tell me a little bit about what that is and how that works?
Absolutely. So if you do have a diagnosis of pancreas cancer, it's important to seek out experts that are familiar with this disease and treat it in high volume. And what I mean by that is seeking out a center like University of Massachusetts where there's a multidisciplinary approach to the disease. A disease team that focuses on pancreas cancer, which includes surgeons, medical oncologists, radiation oncologists, gastroenterologists, and nurses, people who see this frequently. And for that reason, you can have a cohesive team involved in every aspect of your care. But more importantly, or equally as important, have active clinical trials and an active research program looking for screening and treatments for this disease.
Would you say that's a more innovative approach to treating this disease?
I think it's not only more innovative, but it's really the way that we're going to make this the next breast cancer.
And on that note, I mean, do you think there's been a lot more heightened awareness of pancreas cancer in the last decade or so?
I definitely think there is, but not enough. So for instance, if you look at the tradition of breast cancer, decades ago, we didn't have a name for breast cancer. It was a mass, but we didn't know what it was. And then your sister, your mother, your grandmother would be affected. And subsequently, the community, the nation, the world paid attention, and there was research funding. And now we have treatments and cures. So now take a step forward to pancreas cancer. 10 years ago, we had no name. Your family member died of a belly cancer. But now we have a name and we have more attention, but we need more attention, more education of the community and of the nation, and hopefully more funding to help find those treatments.
Are we seeing a lot more fundraising events and more focus on fundraising for this disease?
We're definitely seeing more fundraising. So for instance, we actively fundraise now in the community and nationally. However, we're not seeing the same research funding nationally that we had seen in the past, and we desperately need to improve that.